Hello, I'm Lucy Hetherington. I'm the Senior Research Assistant at Pearson Clinical Assessments, and here with me today is Dr. Reena Vohora. Reena is a clinical psychologist and academic tutor at the University of Oxford. Reena, if you could start by just telling us a bit more about yourself and the work that you do.
So I first became interested in working with older people back in 2015 in my first assistant psychology post, where I worked with older people in community services. Since then I've worked in a range of memory clinics and worked with older people in inpatient settings, so kind of acute hospitals, but also longer stay assessment and treatment wards, and also rehabilitation services as well.
Okay, wow, lots of experience. So in your opinion, what do you think are the main issues faced by the ageing population in the UK currently?
I think it's important to note that actually with advances in medical kind of treatments, we are an ageing population, so people are living a lot longer, which has, lots of positives. We know that older people are able to live very healthy and fulfilling lives, and play a really, active role in society as well. So it's important to remember that people do age or can age well. But on the flip side of that, we also need to think about some of the difficulties that can arise in kind of older age as well. So if we think about the statistics, currently there's around 12 million older people over 65 within the UK. And interestingly, there's been the fastest growth in people over 85. And over the last 15 years, there's been an 85% increase in people living to over 100, which is I think really interesting and fantastic. So I think when we're thinking about the changes in demographics, we also need to think about the support needs that older people may have. So it's important not to see old age as a period that's necessarily associated with ill health. But I think we do need to think about how we support people in a holistic way